We have Dr. Varun from Chhattisgarh. We also have Dr. Neeraj Shah from Maharashtra. We also have Dr. Rahul again from Maharashtra and Dr. Bhoopat Singh Bhati from Maharashtra. Well, we have a number of doctors who will be speaking about kidney stone management. We are very glad to have all of you with us. Well, I would be starting with a very simple question, yet very important. Why do you all think the number of cases when it comes to kidney stones are on high rise these days? Anyone? So, we'll start from here.
It is depending on the lifestyle changes which we are getting it. The idea of not getting stone or to prevent prevention of the stones, we should consider drinking more water. Consumption of salt should be reduced, low salt diet and low on the protein diet I would recommend in a population to the people. And these three basic factors
Yes.
will help in reducing the stone in a population point of view.
True. Dr. Rahul, I like to ask you, what has been the most challenging case of kidney stone that you ever dealt with?
Okay.
So you're gonna recall.
Um, I belong to Maharashtra, Central India. I'm from Vidarbha.
Yeah.
So we have very hot climate. So the means it is one of the strongest bed for stone formers. So we have variety of cases, like most of the patients who they present with anuria, means there is no urine since last 24 hours, and pediatric patients especially, like 10-year-old boy presented with bilateral ureteric stones, and they were in agony, and like parents were totally exhausted. They have visited so many pediatricians, so many hospitals, and then they came to know that urologist is means they come to my setup, and we did stenting, and after 24 hours he started pouring urine. So in such cases it is very crucial to intervene. Means many people may think that the stone will be managed by medical therapy or drinking water, or there are so many hypnotherapies available in our Indian setup. But in such cases, it is very important to intervene, and it is a life-saving, many times life-saving situation.
True. So that was such a case. Well, where I wanted to know that how did you remove the patient's stone?
Yeah,
When I talk about that boy you were
Yeah.
talking.
So whenever there is bilateral ureteric obstruction, many times we don't think of stone. We have to deobstruct the system, urinary system, and start the drainage. And nowadays there are different modalities available, like holmium laser lithotripsy is available, or many times we do keyhole surgeries like mini perk. So whatever the era, what we have seen in the past, there were a lot of open surgeries for kidney stones, ureteric stones. Now, since lasers are available, even pediatric patients we are doing with endoscopic procedures, like no keyhole surgery or small keyhole or mini perk most of the time.
True. Dr. Neeraj would like to ask you what precautions a patient can take in order to avoid stones by far away. But if in case he had one, what can we do to stop the recurrent stones?
True. So, like Dr. Bhoopat Singh said,
Yes.
that drinking regularly liquids, avoiding extra salt in diet, taking low protein diet is the ideal way to prevent stone formation. Still, if a person is getting recurrent stone formation, he should consult a urologist, get evaluated for what are the causes for stone formation. Like some blood tests are there, stone analysis is there, there is some urinary test that we do, and get it regularly checked. So an annual checkup of sonography, urine test, and some blood test that should be done, so that even if the stones are recurred, he can at least prevent a surgery, and by medical therapy he can pass the stones.
What if patient is not coming at an early stage and it's very late when he is arriving at your setup? So what are the misconceptions or the problems which might arrive if he is arriving late to your setup?
Correct. So most of the time patients try to take other therapy, like
Yeah,
hypnotherapy, or
Yes,
there are some
yes.
hydrotherapy they take some homeotherapy, some Ayurvedic treatment. So they get delayed, especially stones which are already blocked in the kidney tube and causing damage to the kidney. If they keep on delaying the surgery, they can have a delayed or
Problems.
affected kidney function,
Yes.
sometimes infection, sometimes the infection can spread to the whole body, and it can lead to something called as a septicemia. So these are the complications that can occur, So that's why patient should make sure that he consults a urologist as early as possible.
Yes, as soon as
especially in a patient where the stone is already obstructed.
True. Well, Dr. Varun would like to know from you, what do you think is going to be a major breakthrough when it comes to kidney stone management?
Maybe some gene manipulations for recurrent stone formers,
Yes.
because like almost the global recurrence rate is around 50%. So you do whatever has been advised so far, but still there are 50% chances of recurrence of stones.
Well, one question for
I
all.
will add one
Yes, sir.
thing in this discussion is that there are
Yes.
few myths in the society. There myths about the stones. Number one, taking a potato in the diet, potato and brinjals, we commonly asked by the patients should stop taking these things.
Even palak.
Answer, potato,
People
tomato,
say
tomato
milk,
seed, tomato, brinjal
Yeah, they
seeds,
say.
everything seed
They say.
element should be taken or not. As a urologist, I would say, and everybody is consensus that it does not make any difference. You should not restrict these items. And if taken in a moderate quantities of any palak, any brinjals, anything like these products, they does not cause the stone formations. Number one. Number two is commonly asked calcium supplements. Doctor, can we take a calcium supplements? Do we get a stone formations? Answer is no. There is no restriction. You don't need to stop your calcium supplements if you are forming a stone. Whatever the dose recommended by your doctor, you should be taking that supplements. Drink good amount of water. Number three, commonly asked by the patients, taking a beer. Very commonly asked
Very,
question.
very common.
Doctor, can we have a beer? Can it prevent the stone formation or will be able to flush the stone? Answer is no. Beer does not do any miracles. It is a
You
water
got to
which
hear this.
it is a water which makes the miracles. Nothing beyond that.
Yes.
And also, last is what are the diets to be what diets to be taken and not to be taken. Nothing like not to be taken. You should take a balanced diet. It should not be a protein-centric diet for a patients who are recurrent stone formers. This is what I would say. You should take a balanced diet and plenty of water. This is what is the crux for all patients who are recurrent stone formers.
Any amount of water level we can fix?
3 liters is the water consumption, but it is not the water, it is the output of the urine which determines everything, because it is person based at what age you are discussing about the urine. It is
Yes.
a basic for in a population, I would say the hydration status is color of urine should be the color of water. This
Because
should be the hydration status.
How
given
our
to the
patients will get to know that we are taking an ample amount of water?
White color,
light colored, light yellow colored or clear colored urine.
color of urine should be the color of water is a dictum for whatever age, whatever height, whatever country the patient is there. This is the hydration status of the patient.
I also would like to add that it is not the amount of liters only that should be
Yes.
considered, it is the regular method of taking
Exactly,
liquids.
he's very right.
So-
Right.
People are in a habit of taking,
1 liter at a
water
time.
in the
Happy.
morning,
Six
so
and
they
a half.
won't take water in the. They suppose
Absolutely
there are so
agree.
many.
And
issues.
when they remember, they will take another liter.
No,
So they will take at a time. So
Sometimes-
binge it, binge
Exactly.
drinking.
Yeah,
something like
that is binge
So that is
drinking.
not
So
acceptable.
at
It has
workplace
to be
there are
regular.
issues with the washrooms and accessibility is an issue. So people sometimes they avoid drinking the water while they're at home.
So it is directly related with how much means in what environment you are working. Like if one person is working
In a
and he's
field.
in a field outside,
He will
and
require more liquids.
His every hour water loss is more than a liter. Then he has to drink a lot of water.
Yes,
So it
yes.
has to be
And-
compensated. And
Yes.
that's why it is said that the color of the urine should be
So
roughly to
it
the
is
color.
That is
always
universal, that
advisable
is
That's the
that
best
it
way
is
to know.
Always look at the color of the urine. It should be light yellow or clear urine.
Clear.
That
Suppose
much,
if somebody is working out in the gym, then that time he will have to compensate with taking more liquids. So
And
that his intake and output should be
he has to always balance this thing, the color of urine and his water intake. Because what Varun sir said that many people what they do, they wake up in the morning and they drink
They
Four
will
glasses,
just
four glasses.
gulp 2 liters of water, yes.
And when you take history of the patient in your OPD, they will tell you that they are drinking ample of water. But what about the frequency of drinking? Means you cannot overload the.
So any intervals?
roughly
not
a glass of
defined
liquid every hour.
interval.
Okay.
Roughly a glass every hour is the best way to know for
Okay.
a person who is having a routine activity. So if a person is working out in a field, definitely maybe 2 glasses. If a person is sedentary lifestyle, maybe 1 glass every hour.
So
Very, very
optimum water intake, what we tell to every patient means optimum is whenever you feel thirsty.
You have a glass of water.
Yes.
So I would disagree with this because if a person is working in a metro city, most of the time he is either in a AC car, AC
won't feel thirsty.
office, AC
He would
house,
feel like
he
drinking.
would not feel thirsty.
Yeah.
So there are certain apps which are available, water drinking app. That is the best way to remember because it gives you an alert.
Okay.
And you are always tech savvy. You are always on mobile. So that alert you are going to take, and you will drink liquids.
Oh,
So that is the best way to remind
Yeah, that's a
yourself.
nice suggestion. Well, one last question from all of you all together. What are your go-to kidney stone management solution to the patients?
So know your water intake, like watch it. Watch like the
Yes.
app may help, or the color of the urine, or like if you're feeling thirsty or not, and balance your intake of water. And the intervals, it should be individualized according to the age and like the kind of work the person is doing, the kind of climate the person is living
Yes.
in. All these factors have to be taken into account.
Water is very important when it comes to
Exactly.
kidney stones.
So and even
Water
after
and
doing
salt,
everything,
Salt as well.
I would say that water and salt. This is the main.
Excess
So
salt
patients
intake is
need
also
to
not good.
Extra.
reduce
So-
the salt
Yes.
intake,
So
no?
instead of reducing
Nowadays,
on the,
even we have to tell about the fast food. Fast
Again, the
food
salt.
and
Again, salt.
Salt.
Negative and
All,
salt.
all is salt.
Crux
So
is
all
salt
in
only.
all,
Cut down on the salt and
people
drink
should
more
take
water.
this message to please go and see a urologist when you have a stone.
Yes.
Don't
As
self
soon as
don't self medicate
Self-medicate.
yourself. Don't go
So-
for coax and all these easy therapies that without any if people think if they approach a doctor they will be advised surgery or something.
True.
So urologist will advise surgery only when it's actually needed.
So medications work when it comes to
So there are so many factors to be taken into account.
Yeah, actually. the stage.
Somebody
like
has
first-
uncontrolled diabetes and he has obstructing his stone. It has to be dealt in with a different approach
Right.
than a normal young person comes with a small stone in the ureter.
Yeah,
So
it
has
all
to be
depends on the
individualized.
patient.
So on an average, if a small stone is there relatively with a normal person,
Yeah.
then the chance of stone passing out will be higher. A bigger stone, the chance will be lesser. That's the simple way to know. And then if there is infection, definitely you have to go earlier.
Thank you so much for being here.
Sure.
Very nice talking to you all. Thank you so